Praise God. We thank God for this opportunity to share. And as you are aware, as I introduced myself earlier, I'm Carol Ighofose. I work as a GP. I'm also an author, and I am a speaker in the sense that I do lots of talks about various health topics in particular, and I'm a missionary in our local church. I am doing this, I've chosen to do this talk particularly because of my experience of having a heart attack. As you can see, I don't know if you can see, at age 48, just over 3 years ago, I had a heart attack. And there are lots to learn from it. So we'll just go into the session, and I'll aim to share very quickly so that I can allow for time for questions at the end if necessary. So before I tell you my story personally, I'll just go into one of the reasons why I realize that this is so important and why it's important for us to do sessions like these. So at the moment, we're in a pandemic. We're grateful that UK at least seems to be coming out of it. We've got a roadmap out of it, but we're still in the throes of a pandemic. And it would seem that at this point in time that the thing that most people die from are maybe infectious diseases like viral disease like SARS-CoV-2. But we're in a time where the #1 cause of death in the world is not from infections, because we've made such great strides with things like vaccines. So whereas that used to be the case, nowadays it isn't. The actual cause of global death in today's world is what a group of conditions that we call cardiovascular diseases. And when we talk about cardiovascular diseases, we're talking about a group of disorders involving the heart and the blood vessels. And that includes coronary artery disease or coronary heart disease, of which heart attack is one manifestation of that disease. It also includes stroke. It also includes heart failure, things like atrial fibrillation, vascular dementia. And these things are very common. I would put blood pressure in there as well. So these are the causes that are the #1 killer for people all over the world. Up until 2017, I think, the #1 cause for death in the UK was coronary artery disease. However, at the moment, according to the Office of National Statistics, the #1 cause is at the moment is dementia and Alzheimer's disease. So still something that comes in the group of cardiovascular diseases. But cardiovascular disease is still the #1 cause of death for women all over the world. Okay, so it's important for us to just note that. And ischemic heart disease which includes cardiovascular disease, which includes coronary heart disease, things like heart attacks, etc., is still the #1 cause of death for males in the UK. Okay, so today I just want to just quickly look at look at coronary heart disease, to just discuss that a little bit more. What causes that? What are some of the risk factors, and how we seek to assess that? So just going on to this next slide, coronary heart disease, which is sometimes called coronary artery disease, is actually a disease of the arteries of the heart. And I've shown you a picture here. The term coronary means crown. And it is said that when the heart is in its natural position with the blood vessels over it, it looks like a crown. And that's why the name coming. So these blood vessels are the vessels that supply the muscle of the heart. So though the heart is full of blood and supplies the rest of the body with blood, the heart itself doesn't get blood from the blood that's in it. It is supplied with blood from these vessels, and they are called the coronary vessels, coronary blood vessels. And they are they supplied various bits of the heart, and depending on which of these is blocked, that's the area of tissue that will die, and that's the area of your heart that would be affected. So for example, in my case, this long vessel here is referred to as the LAD, the left anterior descending artery. Goes all the way down, and it supplies the front part of the left side of the heart. And if you remember, the left side of the heart is the bit that pumps the blood all over the body, whereas the right side pumps to the lung. So this is the artery that was blocked in my case. And so as you can imagine, that means a portion of the left side of my heart is impaired. I will talk a little bit more about that. And as I said, the main reason or the main cause for coronary artery disease or coronary heart disease is a process that we call atherosclerosis. You probably have heard it, this term being bandied about. Ather means porridge-like. It's from a Greek word, which means gruel porridge, and sclerosis means hard. So if you look at the arteries become diseased, and there is hardening, and there is also the core of the plaque that is formed that consists of a porridge-like substance. So in the top diagram, I'm sorry, I'll go back a bit. You can see a normal blood vessel. The lining is nice and smooth. This is the endothelial lining that lines the inside of the artery, and all the blood is flowing, the blood cells are flowing nicely, there's no problem. But in the second one, there is a plaque that is formed, and there's a whole process that goes on to cause this plaque to form. But basically it forms between the bit of the lining that is in contact with the inside of the artery and the other layers, because there are 3 layers of layering the blood vessels. So in here is formed this plaque, which consists of cholesterol, calcium, and some other things. Like I said, white blood cells, it's a whole process that goes on for this to be formed. But on here, on the top of it, is this covering. And this is the bit that is the hardened part, because the inside, this is the bit that lines the inside of the artery, but it's changed, it becomes hard. And people can live with a plaque like this for years, as long as this covering remains hard and unbroken. However, and if it means that if you're exercising, your body needs more oxygen and nutrients, etc. We refer to that as the body need, the metabolic need of the body increases. For example, if you're exercising, you might find that because the space is now narrowed, look at from here to here in comparison to here, you might have a reduced amount of blood going to the tissues of the heart, and that will be manifested as pain, usually a chest pain, and we call that angina. So people who have this plaque sometimes get angina pain if they exert themselves, and once they rest and settle, or they use their special spray, it settles, and that's fine. Now, if for any reason this hardened covering is broken, if the plaque is broken for any reason, it might be because of exertion, it might be even the blood vessels just passing, it might be because of stress, but for whatever reason this plaque is broken, then the porridge-like substance that's inside of the spaces between the blood vessel start coming out inside of the blood vessel. And once that comes out, it's like an injury that's happening inside of the blood vessel, the coronary artery. And our bodies naturally seek to repair injury. So just like if you cut yourself, the body will start making the blood clot, because that's the natural response. That's what's happening in here. And plus these things that are in here as well, they attract clotting. So all the platelets in the blood, they will be attracted and a clot will form. Now, in the middle of the coronary artery, a clot forming on top of this plaque is bad news, because that is going to cut off the blood supply to the muscle of the heart that it is supplying. And that is what causes a heart attack. So that's essentially what happens in a heart attack. So just going back, my own experience, this is me with two other ladies who've had heart attacks. We've done a podcast for the British Heart Foundation called the Ticker Tapes. You can find it, it's on the internet or on the British Heart Foundation website. And this is me just saying, I felt they didn't believe that I was having a heart attack. And why is it that they didn't believe? And when I say they, I mean the paramedics to start with and the doctors in the hospital, even though I'm a doctor, they didn't believe that I was having a heart attack. And the reason why is because I do not present as a typical person who has a heart attack. Maybe when you think of a heart attack, you think of a male, an older male, maybe a white male, somebody who smokes, somebody is a little bit, like I said, overweight, has diabetes, etc. And we have that typical image of somebody clutching their chest and falling over. But that was not what happened to me. My symptoms were nothing like that to start with. I had planned to read an excerpt from my book to describe how I felt and what happened, but I'll just tell you quickly because time is against us. But I went to work the morning of the 22nd of January 2018, did my morning shift and was meant to leave work at about 12:30. I was running a bit late, so at 1:45 was when I left. But before I left, I felt I had what I thought was indigestion symptoms. So I felt like a bit of heartburn. And I was fasting on the day, again, just, for spiritual development. And I thought, okay, it's because I'm fasting. As soon as I get home, I'll eat. And I was gonna do another shift in the evening. So I thought I'll go home, eat, and that will sort that out. My friend, who is also a doctor, wanted to talk to me. So as I got in the car, I decided I would call her using the hands-free Bluetooth system. So I was talking to her whilst I was driving, and I realized that this indigestion thing wasn't settling. So I said to her, her name is Dr. Tracy Bempa. I said to her, Trace, I don't usually have chest pain, but this feeling in my chest is not going. And we started talking because she went into doctor's mode and started asking me all the questions that you would ask a patient. But it still didn't make sense, because when we went through all my risk factors, and we'll go through those for having a heart attack, I didn't have any of them. And the pain wasn't the typical crushing central chest pain that we get taught about at medical school. So we just kind of dismissed it and agreed that I should just keep an eye on it. And if it persists, I would at a later date go to the GP and get it sorted. I knew that I was passing the A&E department on my way home. So I said to myself, without even saying this to Grace, that if there is a problem, I will just go into the accident and emergency room on my way, because I was passing the A&E department on my way. But I didn't get that far. So the long and short of it was that I was in fact having a heart attack. So what is a heart attack? I've given you a bit of background as to what happened in the arteries. So I'm just going to ask anybody who, if you would like to unmute your mic and just tell me what, in your words, what you understand a heart attack to be. If anybody would like to do that. Okay. So a heart attack basically is when there is a disruption of the blood supply to the muscle of the heart. And so that happens, like I said, because usually there is atherosclerosis, there is rupture of the plaque, and then there is a clot, which we in medicine call a thrombus, that is formed, and that blocks off the blood supply to the area of the heart muscle that particular artery supplies. That's a heart attack. So we refer to a heart attack as more a circulation problem or a plumbing problem. Now, you might have heard the term cardiac arrest, and people tend to use these terms interchangeably, but cardiac arrest is different from a heart attack. So cardiac arrest is more an electrical problem, you could say. So the heart has a type of electricity, you could say, in the sense that it has conduction pathways where the signals are passed from one muscle to the other and causes the heart to contract and to work the way it works, you know, in sync with each other. The ventricles together, the atria together. And just so that our heart functions the way it functions, you have signals passing through the muscles, and there's a whole complex network of signals. So when you have, for example, a tracing of your heart done, which we call an ECG here in England, that's measuring the electricity, as it were, of the heart. And you can get a lot of information from that. Now, when something goes wrong with that, for example, if the muscle of the heart is interrupted, if you think of the muscle being the road, and then there are potholes in it and whatever, when the muscle is defective from a heart attack, then the electrical signal can go funny, can go haywire, and that can disrupt the electrical pathway. And as a result, the heart will not be contracting normally, it will go in chaos and everything will just go haywire. And in that case, the heart isn't able to pump blood, so the person loses consciousness, becomes unconscious, and that's what is called a cardiac arrest. So in a heart attack, just to go to this slide here, in a cardiac arrest, which I describe as an electrical problem, the person will be unconscious. So the person touching the chest and fall unconscious to the floor has a cardiac arrest. The person like I did, who was still sitting up, still conscious, but having signs of sweating, feeling disoriented, initially having what I thought was epigastric or heartburn pain, but later on getting central crushing chest pain. Other things that might happen is that that pain in my chest may go up my jaw, up my neck, into my jaw, it may go down my left arm. Sometimes it goes to the right arm. I feel unwell, I may feel nauseous, I may vomit, I may be sweating, the color may drain from me, I look unwell. That is a heart attack. And it presents different for different people, but those and the symptoms, it is said, can be anywhere from here to below your breastbone. So there's from here to the top of your stomach, should we put it that way. So anywhere between there, you can get symptoms as it relates to a heart attack. So the heart attack person is conscious, but the cardiac arrest person is unconscious. And for both of those, it is an emergency. We need to call 999. So I have had a heart attack. Just to say that if a heart attack, as I mentioned, and or cardiac arrest are emergencies. And if that happens, there is a time frame within which it is crucial that the blood supply to the heart muscle is restarted, if you like. We use the term reperfusion. So that blockage needs to go. That blockage needs to stop. And so that blood can flow again to the heart. I'm just going back to this slide, because if that is happening, so in a heart attack, we need to get the person to a place, to the hospital, where this blockage can be moved and the muscle can be reperfused. If it's a cardiac arrest, then you, the bystander who's there, who sees this, if you could do CPR, if you can start CPR on that person, that could probably save the person's life, because you're artificially getting the heart, you're artificially squeezing the heart between the spine and the chest bone, so that the heart you can get some blood flow out up to the brain and to the body until the other help arrives. And the other thing that would work if somebody has a cardiac arrest is if we get a defibrillator. So a defibrillator will sort out the electrical problem. Now, defibrillators are dotted all over, in different places all over the country. There are lots of defibrillators in parks, in supermarkets, at train stations. So if you should ever be in a situation where that happened, you could ask, and you don't need to be trained. They are automated. They tell you what to do. You get it, you open it, and you do what it says. If somebody has a cardiac arrest, if a heart attack person doesn't need defibrillation, a cardiac arrest person does. And at this point, I'd like to encourage you to consider learning CPR, so cardiac pulmonary resuscitation, and using the defibrillator. There are skills that anyone can learn. Again, go to the British Heart Foundation website. There are training videos on there, and anyone can do it. It might be that you just saved somebody's life. And it is worth noting that it is most likely to be somebody that you know, that you witness having a cardiac arrest or a heart attack. We hope to God it doesn't happen, but in the cases where it happens, and it happens a lot, it's usually people that you're familiar with, somebody that you're familiar with. So during a heart attack, one of the main things, again, is for somebody to have aspirin as long as they're not allergic to it, because it helps reduce the clotting process. And the main thing is to get the person to the hospital, whether it's any, in Leicester where I am, we have a specialist heart hospital. So to get that person to Glenfield would be the best thing, and then to get them to the catheter lab, where in the catheter lab, they put that special catheter, special tubing to unblock the artery. And there are special bodies in the country and in the UK that are set up to make sure that these things are done properly and they are done on time. So we have MINUP, for example. It's a body that does an audit of everybody who gets admitted with a heart attack. And they look at certain things like, did the person get to the catheter lab on time? Did the cardiologist get involved? And they look, and it's monitored. And there are also the guidelines, the National Institute for Health and Care Excellence, which advises us how these conditions are to be treated. So wherever in the country you live, you should get the same quality treatment. Unfortunately, that doesn't happen. And in my case, there was a delay for me getting the treatment that I needed, which has results. But just so you know, you can go to these websites. There is a MINUP website. You can go to NICE. And like I said, there's British Heart Foundation, and have an idea of what should happen. For example, from the time you call 999, if you think you're having a heart attack, to the time they put that stent in to reperfuse, to unblock the artery and reperfuse the heart muscle, it should be around 120 minutes, i.e. 2 hours. That is the guideline. That is what should happen, not the 20 hours that I waited to have mine happening, because we have a saying in medicine, time is muscle. The longer you wait, the more damage is done to the heart muscle. And once the heart muscle is damaged, it cannot be replenished. That's it. If your bone is broken, it can heal, but not heart muscles. That's it. When it dies, it dies. So just so you're aware of that. And having had a heart attack, I am here, I'm sitting in front of you today, I'm smiling, I'm happy, God has been good to me. But there are lots of things that could have gone wrong, lots of things that can still go wrong. I'm still trusting God, of course, and I believe in Him for my healing. But it is worth noting that it is generally a condition that can be that can be prevented. And I haven't talked a lot about the risk factors, but just to say, we know a lot about what causes a heart attack, but we still don't know everything. So just running through very quickly the risk factors. If you're a man, you're more likely to have a heart attack than if you're a woman, especially if you're a younger woman. Younger women tend to have more estrogen on board, and that somehow protects us. As we get older, past the menopause, we catch up with men, and our risk is about the same. But sex, i.e. male, is generally more likely to get. As the older you get, the more likely you are to get a heart attack, because your vessels are getting harder and more things are happening in your blood vessels. There's more chance for a plaque to have built up over the year, depending on your genetics. So some people have a condition, for example, called familial hypercholesterolemia, where their cholesterol level is just high, no matter what they eat, no matter what they do. It's just a mutation of their gene that is abnormal. And in that case, you would be prone more to getting a heart attack. If it runs in the family, usually you know about it and are being monitored by some specialist. In terms of ethnicity, we know that Black and South Asian people are more at risk of cardiovascular diseases in particular than the general population. Asian people are more likely to get a heart attack than Black people. And that's a whole other thing that, that the British Heart Foundation has looked into and has studied. There are statistics out there regarding that. So those are things that put you at risk that you can't change. Things that you can change is your lifestyle. So what you eat, how much exercise you do, whether you smoke, smoking is deadly. If you take a lot of alcohol in, if you're overweight, if you've got diseases such as high blood pressure, diabetes, nowadays they're saying that low vitamin D levels can put you at risk, and even things like poor dental health has been highlighted as a possible cause. I don't know the details very much, but that is one of the things that's been highlighted. And women, if we've had gestational diabetes, subdiabetes when we were pregnant, if we had high blood pressure when we were pregnant, which I did, I had high blood pressure in my pregnancy. And if we've had something called eclampsia, again, another pregnancy-related problems. If we've got problems like polycystic ovaries, those things put you more at risk of getting heart attack as a woman. So a lot of things, some we can do things about, some we can't do anything about. So for me at 48, without high blood pressure, without diabetes, with a low cholesterol, less than 5, with normal body weight, the only possible thing that you could say, maybe she was a stressed out GP, but stress is not counted as an independent risk factor. It is listed as an association rather than an independent risk factor. There is no way why I should have had a heart attack. But that's another story for us to talk about as to why did you really have a heart attack. That is something, as you can imagine, that I did ask myself. So early complications could mean that I could have had a cardiac arrest and died. Thank God that didn't happen. Other things that could have happened, or that actually happened, was that because my heart wasn't pumping as it should, the blood in my left ventricle began to pool, and so I developed a clot inside of my heart. And for a while, I had to be on lots of blood thinning medicine. That has resolved, thank God. But other things that could happen is the fact that the muscle could deteriorate more. It could cause problems with the valves because there is what we call a heartstring is attached to part of the muscle. If that had deteriorated, that could cause more problems. The inflammation from the muscle deteriorating could have caused an infection, and so particularly the lining around the heart, called the pericarditis, could have become inflamed and infected, and that could cause a lot of problems. There could be a hole formed in the septum, the muscle of the heart that separates the right side from the left, because again of the damage to the muscle, depending on which artery is affected. In my case, it wasn't the septum that was affected, but if that happens, that can form a hole, and then you'll have the right and left blood mixing, and that would mean low oxygen level, and that could be devastating. It could cause something what we call cardiac tamponade, and people can die. And also, there are lots of psychological effects that occur as a result of having a heart attack, which I won't go into at the moment. One of the things that is something that needs to be considered depending on the damage that is done to your heart, is whether or not you might have to live with an implantable cardioverter defibrillator. That is something that I'm still considering. I've got a number in my head that if my heart should deteriorate and goes below a certain number, then I will have it. But at the moment, I'm kind of in the gray area, and I'm being kept there, and I seem fine. I'm doing okay. I'm trusting God. So I have not had an ICD, but basically it's an implantable defibrillator, so that because the muscle of my heart is not the same as it was, if the electricity should go funny and I did develop a cardiac arrest, it would kick in and defibrillate me quickly. And that could mean the difference between life and death. So that is also something that one has to consider if you've had a heart attack. After a heart attack, as I've said, it is possible to live victoriously. It is possible to live a normal, healthy life. There are definitely adjustments. There are definitely restrictions. My life has definitely changed, but I am still living victoriously. The main things that need to be paid attention to is your lifestyle. So the way you eat, your sleep, which is I'm still working on because I still don't have a good sleeping pattern, years of working night shifts and all over, and all those things impact. So you eat, you sleep, the amount of exercise you do. It is very important after a heart attack that you go through a program of cardiac rehabilitation. I've done that. So it's to teach my heart again how to function and gauge the amount of stress that my heart can deal with, and so that I know what my heart can deal with and how to go about my activities so I don't overdo it. And the importance to relax. We tend to not pay enough attention to this at all, especially as women, but it is crucial. Like I said, the biopsychosocial effects. So my own body, my mind, socially, how does that impact on my work? I've had to give up some things I can't do. All of that impacts you. But again, you have to make adjustments and live. I have to take medications every day. I still take medications. Theoretically, I'll take medications for the rest of my life, unless my faith or a miracle happens where I get to a point where I don't need medications. But I also believe those medications are the way God works as well. He's given man the knowledge, and they are medications that prevent my heart worsening, prevent me developing heart failure to a worse degree than I have it, because I do have a degree of heart failure. But all of those are things that you have to contend with. Every day I have to take about 10 pills or something. You have to have lots of appointments because you're constantly being monitored, and so you have to fit those in your life. Work, like I said, change. For me, I've had to make adjustments to my work life. My family life has changed, and I'm talking heart attack is not just for the person who has it. It affects the entire family. If it's a woman like me, my husband, it has implications. Are you willing to, at that point, step up and really show that you love your wife as Christ says, as Christ loved the church, and regardless of what it means, then do the things that it means doing? It has a lot of implications for family life. And in terms of whether or not I can still drive or flying, I had to give up driving for a while, didn't go on holidays, fly abroad for a while, but those things I'm able to do and still able to do now. So just to summarize, I don't expect you to read this, but just to say that cardiovascular diseases and coronary heart disease are the top causes of death worldwide. So it is very important that we bear that in mind. And coronary heart disease is indiscriminate. It affects men and women, but it kills more than twice as many women as breast cancer in the UK every year. And it is the single biggest killer of women worldwide. A heart attack and a cardiac arrest are both cardiac emergencies, but are different and warrant different actions. And like I said, time is muscle. If you think somebody's having a heart attack or a cardiac arrest, dial 999, act quickly. It is very, very important. There are inequalities in how heart diseases are managed. Unfortunately, that's a whole other story. But as a woman, as an ethnic minority, unfortunately, we are at risk of unequal health management. And like I said, it has far-reaching individuals for the individual, the family, the society at large. So having done this today, I hope I've raised awareness, and I hope that I've made some inroads into tackling the inequality, the health inequalities that accept, even just by you being aware, and also provide reassurance about living well after such an event. I would like to encourage individuals to go to the British Heart Foundation, and I'm an ardent supporter of British Heart Foundation. They've done me the honor of using me to front their website. So you can go there, you can donate, you can look up how to learn to do CPR, all of those things you can do. So I would encourage individuals, please, to do that. I'm not sure if at this time we have time. I was going to read an excerpt, but I think time is against us. But it is now 25 past, and sessions are meant to be finished at 12:30. So if anybody has any quick question, I will take it at this time. But just remember, as the topic of my book says, we are fearfully and wonderfully made. God has made us in such a way that our bodies can deal with lots of insults. And I believe that he has kept me because he's still got work for me to do. And that is what I intend to do. And I want us to just remember that we're special, we're deliberately made by God for a purpose. And let us endeavor to do our purpose. God bless you. Any questions? You can unmute your mic and ask.
God bless you, Dr. Carol.
God bless you.
God bless you. It's Missionary Sue.
Oh, God bless you, Sister Sue.
God bless you. Brother Rupert just wondered whether there's any special exercises that you can follow that will help to build resilience around the heart. Okay. And diet, he says.
Okay. So generally speaking, exercise is what is recommended. So it's recommended that you have about 30 minutes of exercises at least 5 days a week. And it depends on you as an individual. So if you've been having regular exercises, then you know what your body can deal with. But it is recommended that you aim to exercise so that you are at least a little bit short of breath. So whether it's walking, whether it's swimming, I have a special machine that I call a Maxi Climber that I use a lot. Those things are as good as any, but the consistency, the regularity is important. And there is something that we call activity. So not necessarily maybe reaching up to exercise, but just being active. So don't sit down for longer than an hour. I am guilty of that because I go to work as a GP, I sit at the desk and I can be sitting for 3 hours. But the recommendation is that sedentary, i.e. sitting down for long periods, is as bad as smoking. So if, for example, you work in an office or you're doing something where you're sitting for a while, get up at least every hour, walk around for 2-3 minutes, do something. I always say, make sure you're drinking lots of water so you have to get up and go to the toilet. Even that, but that makes a big difference. If you're sitting down watching TV, there are exercises that you can do just to keep you active. Maybe Sister Mel's session will deal with a little bit more of those, but just armchair exercises, just moving your legs, just getting up, standing. Those things make a big difference. It is generally accepted that the Mediterranean style diet is what is recommended. So more of a plant-based diet with low fat, low sugar. And it's not just cutting out fat totally, but it's cutting out saturated fats. Lots of beans and legumes and those things. Reducing salt is important because that reduces the risk of getting diabetes. and the way we eat. So not just grabbing something and eating it, you know, in a rush, but actually sitting down with the family and enjoying the eating experience. That goes a long way in reducing cardiovascular diseases. So not just what we eat, but the way we eat.
Thank you for that. I was just thinking while you were talking, what about inherited heart disease, Dr. Carol? Because many of us have got family members. How is there like a program where they can identify, maybe at a younger age, even from birth, those who may be susceptible to heart disease?
Okay, so like I mentioned, there are some inherited conditions. One of them is that familial hypercholesterolemia, where your cholesterol is very high. Usually people who've got that in their family has somebody who dies from a heart attack very young, like a male below the age of 55. Or so if that happens in your family, then the rest of the family should be screened to find out why that happens, because we don't expect that. That is considered early to die from a heart attack. Some people, for example, you've heard about footballers who've collapsed on the pitch, for example. They've got a lot of times a condition called it's a condition where the heart muscle becomes very, very thick. We call it cardiomyopathy. And again, that is something that can be passed on in family. So if something should happen like that to a family member, everybody should get checked. There should be checks for that. And it is known if sometimes people have some kind of funny electrical pathway in their heart. So they get, maybe they pass out, they block out, or they get weird palpitations. If that's investigated and it's found to be one that is passed on in family, again, the family members would be looked at, would be examined. But there isn't a program as such that I'm aware of that just picks up any and anybody. It's usually if there's a history of something, and if you're not certain, speak to your GP, and if necessary, they will refer you to the genetics department for you to be investigated further.
Thank you.
You're welcome. Okay. If there are no other questions, I think we can look at leaving the room and going back, because it's now 11:32. I'm not sure if we were allowed extra time, but I know that the session is meant to finish at 11:30. So if no one else has any further questions, then you may leave the room.
Thank you very much, Dr. Carol. That was absolutely brilliant. Such a blessing. Wonderful. We've gained so much knowledge and experience, and we are very grateful. May the Lord continue to bless you and continue to keep you in Jesus' name.
Amen.
Thank you, Sister Sue. Thank you, Missionary Sue. And thanks, Brother Rupert. God bless.